So the instability of a complete lower denture is something which is often seen as unavoidable. Is it unavoidable? Patients generally expect that their full lower denture is going to be moving or loose, just from experience. So being able to make a full lower denture stable is a result of balancing everything between the retaining forces and the displacing forces. Obviously, when the displacing forces exceed the retaining forces, then looseness will result. The long-time denture wearers often accept denture movement as normal, or you have those people who don't even notice the movement in their dentures. So you'll have patients that come in and say, my denture's really loose, I'm getting food underneath it, it's moving all the time. And you might have a look and decide that that denture is really quite stable for a full lower denture. On the other hand, you'll have patients who say, I have never had a problem, my denture never moves, although they sit in front of you and open their mouth and it just about pops out at you. So patients' ability to control the dentures has a lot to do with this, and the time that they've been wearing dentures. Someone who's been wearing a full denture from the age of 20, who's now 65, doesn't know any different. They've adapted really well to wearing a full lower denture. They don't remember what it's like to have their own teeth, and they generally cope really well with full dentures. Someone who's 65 and just having the remainder of their natural teeth out and wearing a full lower for the first time, they're going to find it really difficult going from having natural dentition to wearing a full lower denture. So the patient's ability to control the denture is like the fulcrum point of the success or failure of the denture. So the better the patient is able to control the denture, the more they've adapted to wearing that denture, then the retaining forces are working for them and that denture is going to be more successful. If they don't know how to control the denture, if they have only received their first full denture recently and they haven't adapted to it, then they don't have the ability to control it the way they need to, and the displacing forces take over and the denture is going to be moving more or feeling more loose to the patient. So denture control comes with denture wearing experience, basically. So some causes of the instability in a complete lower denture. You can have an incorrect centric occlusion. So when the patient closes just purely in-centric, you may have contact on one side before the other, or more contact posteriorly than anteriorly. So this imbalance in the occlusion is going to cause the lower denture to move every time the teeth come together. While the teeth may touch on one side first and then the denture adjusts to bring the other teeth together, then that denture is going to be moving.